Good morning and welcome to your COVID Talk with local health authorities. I have with me Dr. David Persse representing the City of Houston, Dr. Umair Shah representing Harris County. I want to thank you to past President Kathy Finninger of the Rotary Club of Houston. This is sponsored by the Rotary Club of Houston. I am Stephen Williams, Director of the Houston Health Department. Let's get right to it. There seems to be a little conversation from anyone, including health leaders, about the plight of children. One mom says that her kids were having trouble falling asleep, do not want to get up and go outside, or sick of games and even TV. Do you have any creative suggestions on how to deal with what seems like a potential disastrous mental health pandemic?
Well, you know, let me
you're the parent.
I was going to say, as a parent, I've got a 10-year-old, a 6-year-old, 3-year-old, and I'll be honest that just yesterday I had this discussion with my 10-year-old that I know you've been virtually doing schooling and you're just in front of your desk the whole time, or your table, and then you, as opposed to just then wanting to go do something else, you're then sitting back at that same place. And I think it's really hard for children right now in so many different ways. Remember, there's not been a spring school year. It sort of bled into summer because you're still at home, and it's bleeding into the beginning of this school year and you're still at home. And so I do think some real responsibility on the part of the parents to be creative is absolutely the right question. And what we've been trying to do is to say, okay, go in the backyard, go somewhere, try to at least interact as safely as you can with your own siblings, but do it in a different environment, not in that same living room or not in that same bedroom that you're in. Go somewhere else. If you're in an apartment, it's difficult, obviously, because you've got the same kind of scenario, but you've got other people in that apartment complex. But can the parents take that individual, that child, out somewhere so they can physically get out of the environment of the apartment or the home? And I think this is really whatever you can do for books, reading to them, sprucing things up, getting in the car. This is the one thing, Stephen, that we found, getting in the car and just driving around, even if you don't go and get out somewhere, but just driving around, roll the windows down, look outside, be outside, look at the community in that sense. That's the kind of stuff that you have to be creative with, and that's what we've been finding.
Yeah. I would remind folks that the parks are open. Mm-hmm. These are big, huge open spaces where social distancing is relatively easy to do. It's convenient if you have siblings, or perhaps, well, it's really convenient if you've got siblings, right, in the same household. But I think the idea of getting out, and it's not just kids, it's adults too. So.
Yeah, yeah.
So getting out is healthy for everyone.
Absolutely. Yeah.
Change the environment.
UTMB employees received a letter saying the hospital had a budget gap and would need to cut staff. What is the status of hospitals now? And with reduced staffing levels, how safe are patients?
Well, they're hurting.
Yeah.
I mean, and financially hurting, and all across the country, and obviously here locally, they're hurting. And as each hospital has a different, their line of sight on their bottom line is very different. As far as patient safety, that's what they have, as far as we know, not compromised.
Right.
And that, I think, is the critical piece, is that they may have had to cut back on other kinds of personnel and activities, but the actual patient care side, that's the part that they've been focusing on.
Yeah, I want to use this question as an opportunity to raise something I raised up several weeks ago, and that is the misalignment of healthcare reimbursement with what the community needs from a healthcare standpoint. That's so right. When we had the lockdown, and the hospitals were told they can't do any elective surgery. Well, that's because that was painful, financially painful, because hospitals make a profit on elective surgery, which they use to offset the losses on medical care. What America needs for the hospitals to be paid adequately for taking care of people with pneumonia and viral illnesses, so that the hospitals can remain full at a profitable rate, taking care of whether it's elective surgery or the flu. And I think that's a huge problem. That is a fixable problem, but it has to occur in Washington.
Absolutely.
Yeah.
JAMA reports on a small research study in Massachusetts and says the number of visits to a doctor did not increase the possibility of picking up COVID. Why are we continually being told not to make unnecessary doctor visits? This is preventing some of us from going to doctors when we probably should. That's a really good question.
Yeah, I think that is a good question. I think it's time that narrative gets changed, because in the beginning, before we had all the safeguards in place, going to the emergency department, going to a doctor's office, in the very beginning, a long, long time ago, might have been a bit of a risk factor. And in addition, the hospitals and the doctors were still trying to spool up and figure out how to handle this stuff. We're way past that now. So if you need to see your doctor, call your doctor.
That's right.
Not a question, but I've heard from anecdotally that a lot of folks are not really comfortable with virtual visits.
What's interesting, and you're right about that, and then when you talk to doctors' offices, and even large systems, they're actually seeing a real increase in the virtual visits. And so we talked even earlier with colleagues at Texas Children's, and they were talking about how their virtual telehealth visits have actually increased significantly, and they were saying that there's actually been well received by their parents. Now that said, there are certain kinds of visits that are just not good for telehealth, and if you have to actually touch a patient or do something physically with that patient, that does not work with telehealth as well. And that's where you've got to really figure out what is really requiring an in-person visit versus what you can do by a televisit.
You know, we've actually seen an increase in client participation in some of our programs and doing virtual visits.
Yeah.
So I think that it's really important from a cultural standpoint to see what fits what population.
That's right. That's right.
With all the privacy laws, if an employee refuses to confirm or deny that they were diagnosed positive, but we have a reasonable suspicion, what should we do?
Yeah, that's a great question.
It's probably more of
An answer
It's
in
an
1
HR
minute.
question.
HR and a legal question. But I do think there is a responsibility both for the worker as well as the workplace to ensure the safety of that workplace. And so if there is a concern about health and safety because of COVID-19, then that has got to take some paramount importance. And certainly having that discussion is really critical with HR as well.
You know, this goes back to the conversation we had a little bit before. So, and I've talked about this before, but when I was a little kid, the mentality was not so much about me. The mentality was about the communities, because, you know, we had measles, we had polio, we had, all these other illnesses. And I clearly remember my grandmother, who was kind of like the neighborhood mom, and all the kids in the neighborhood and all the families, we were all one big family and we looked out for each other. Today we have a society where it's about me and my family. And then, and to some people, it's me and my family and the heck with everyone else. And that is what is raising a lot of these concerns and this distrust and stuff. And I don't know how to fix that. But I see that's part of the problem.
Thank you for joining us for our COVID-19 talk. We'll be right back.
Wash, washy, wash, washy, wash your hands. Scrub them while you sing the song. Wash, washy, wash, washy, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Respond to the upcoming 2020 Census Survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
You have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
doesn't mean that we can't be alone together.
Have questions about the coronavirus?
I'm here to share some simple steps you can take to help protect yourself and others.
Avoid touching your eyes, nose, and mouth.
Wash your hands often with soap and water for 20+ seconds.
Cover your cough or sneeze with a tissue.
Clean and disinfect surfaces and objects. Wash hands after touching commonly used items.
Together, we can help slow the spread.
Welcome back to the COVID-19 Talk with local health authorities, sponsored by the Rotary Club of Houston. In a small department, isn't it better to opt for a HIPAA violation and confirm that an employee is out of the office for 14 days in quarantine?
I don't think you ever want to opt for a HIPAA violation.
Yeah.
I'm not sure that's a dangerous.
I'm not sure I understand the question, but
actually, you could really lose your business.
Yeah.
Okay, let's go to flu. Given our current situation, when should we get a flu shot this year?
Oh, as soon as it's available.
As soon as it's available.
Yeah.
I'm going to challenge you on that. Sometimes people say that you can get one too soon and it won't last throughout the flu season. And maybe I'm an example because in the last 3 years I've had the flu twice and I've gotten a shot every time.
Yeah. That'd be a question probably for somebody like Hotez, but I've not heard that you get it too soon, that it wears off within that same season. I've not heard that.
I haven't heard that, and my other concern is if you wait too long, and then now you can get the flu in between. So I would say opt for earlier than later.
Okay, so I'll go ahead and get it then. Regarding the flu vaccine, which seems to be very low efficacy rates, under 40% each year, why should everyone still get the flu shot?
I would challenge that. It's not an accurate statement, under 40% each year. It does vary from year to year, and we have had years where it had poor match. Usually it's in the 60-70% range, as I recall.
That's right.
Above 50%. Can you discuss the cost of flu shots for insured and uninsured? Which type of flu shot should we get? Are there different kinds? And how can the county and city health departments plan to accommodate the large uninsured population needing the shot?
That's a good
question. Really getting more information on what the flu vaccine availability is going to be, and county and city health departments are both going to have strategies. We've actually talked about even through our COVID-19 testing to actually be able to offer the flu vaccine just right through as people come through. We also recognize that our clinics have been, obviously curtailed some of their appointments and their ability to see people, but we're still looking at how we can utilize those clinics as well. And then there's the other part that the health department has, which is the assurance role. We assure that there is flu vaccine being provided by other providers in the community. So there are a number of things that the health departments do. I don't know if you want to talk more about the flu vaccine itself this year. Yeah.
Well, yeah, so the flu vaccine itself, what happens is we see what's going on in the southern hemisphere because that predicts what we're going to have, and so that's already on its way. And in addition, the manufacturers are making more. I can't remember how much. I want to say it's like 30 to 50% more vaccine this year, anticipating an increased demand. Now, even with that, so there's about 330 million Americans, and I think they're making somewhere in the neighborhood of, instead of making 140 million doses, is to make about 200 million doses. That still leaves a third of the population.
If the flu season is so worrisome to medical leaders, including yourselves, why have they and you not added getting a flu shot to recommendation to the wash jingle and the current protocols for protecting the coronavirus? Why not start warning people to encourage an early flu test rather than waiting to warn?
Well, let's go back in time, because if you remember, this was February, March of last year. We actually did encourage the flu and the vaccine at that time. And don't be surprised, whoever asked this question, thank you for asking it, because guess what? That's exactly what we're going to be doing, is to add that jingle in there.
Okay, several people asking this. Dr. Barnett in Midland says all of his patients were cleared by his use of, is it budesonide, by the nebulizer treatment. Your comments?
Yeah, that's the steroid, the nebulized treatment of steroid?
Yeah, I guess.
Yeah, so I saw that. And then I went and I looked it up, and yeah, he's making that claim, but the limited amount of research that I've seen on that did not support his claim. So that's all I can say.
Yep.
Speaking of Peter Hotez, according to Dr. Hotez, over 500,000 Americans will not take the COVID vaccine once it's made available. Can it be the byproduct of a failing education system and an internet that broadcasts so many negative information on every issue that our people have lost the ability to think, or something less sinister?
Look, Dr. Persse and I have a very close relationship with Dr. Hotez. He's fantastic. I don't believe that what the person asked is exactly what Dr. Hotez said, but the key point of this is that, yes, misinformation, availability of incorrect information, and really this movement towards vaccination not being what I want to do for myself or my family, that is a very troubling set of signs that we have fought for years, and we're going to certainly be fighting this year as well.
Although there is no definitive proof, a doctor at the Mayo Clinic said that those who had prior vaccinations, like for pneumonia and influenza, have a lower risk of COVID disease. Have you heard of this?
Yeah, I heard about that, and I looked that up. And so there's also theories based on some countries that had better or worse COVID and what vaccines were routine in those countries. And in the beginning, there did seem to be some sort of correlation. The last I've seen is that there might be some, but it seems weak.
Yeah, I think the other thing to say is that those who are more likely to get vaccine may also be more likely to wash their hands and do all sorts of, so there may be some intermingling of some
true and unrelated.
So they're probably behavioral influences.
That's right.
Perhaps,
that's right.
Yeah.
Dr. Persse, you say recovery data is a guesstimate and to focus on the number of new positive tests. The charts on dashboards show the large number of recovered, so doesn't that create a false feeling for us?
No, we do know that most people recover, so the recovery numbers generally are a guesstimate, but the reality is, you know, we're so far into this now, if you look at the total number of cases that have occurred, the vast majority of those folks have recovered, right? Statistically, a large number of those people have recovered. But unfortunately, also a large number of folks, you know, got really, really sick, wound up in the ICU for weeks on end, and some of them died. So.
Okay, very quickly, Dr. Shah, the Harris County dashboard shows an age group impacted much higher in the 20 to 40 age bracket. What's causing that?
Yeah, so you know there are a lot of reasons that we've put in, but one of the biggest concerns that we have is that message that we've had for older populations be concerned. That meant that a lot of folks in the younger population thought, yeah, I'm invincible. The other is that's also the age group that a lot of people are out working and being around other people interacting. That may also be mixing it. And there are a lot of things that we're obviously watching with the Hispanic population, very concerning in the younger population. So a lot of factors that go into it.
Thank you for joining us for our COVID-19 talk with local health authorities, sponsored by the Rotary Club of Houston. We'll be right back.
With coronavirus spreading, people at higher risk must take extra precautions. You are at higher risk if you're over 65, or if you have an underlying medical condition like heart disease, chronic lung disease, diabetes, or if your immune system is compromised for any reason. If you're at higher risk, stay 6 feet or 2 arm lengths away from others. Better yet, stay home if you can. The choices you make are critical. Please visit coronavirus.gov for more information.
Learn to cough and sneeze with your pal Grover. Step 1. Realize you're about to sneeze. Step 2. Move your elbow toward your nose and mouth. Step 3. Gesundheit. 1, 2, 3. Remember to cough and sneeze into your arm or elbow and not your hand.
Honey, what I think you need is a socket wrench.
I played JV basketball.
I'm sorry. I don't think it looks right.
This is good, and it's all good, baby.
Is it really all good?
If you love me enough to routinely test your handyman skills, not to mention the strength of your marriage, then of course you'll visit nhtsa.gov/the-right-seat to make sure I'm in the right car seat.
I'm gonna call my dad.
Welcome back to the COVID-19 Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. TMC dashboard now includes metrics on the reproduction rate of the virus. Please explain.
I'll take it. So, so the reproduction rate is, well, first of all, there's an R0, which is a characteristic of the virus and how many people it would infect with no other influences, right? So the reproduction rate that you're seeing is that with mask wearing, with social distancing, with avoiding large gatherings, well, how does that change it? So what the reproduction rate really is an estimate is that for any one person who's infected, how many more people will they infect? And so it's less than 1. And if we can keep it there, then the outbreak should subside. And if it's greater than 1, it's going to spread and get bigger.
Give us some good news, anything.
Well, the replication number they're calculating is 0.82 or 0.83 this morning.
It's under 1. Yeah.
It's under 1. And so that shows that wearing masks and all these other things that they were.
Yeah.
And look, and the other good news is that, look, despite not having a lot of real strategy at that national level, we have been able to fight this, tooth and nail here locally. And that goes to our community. I mean, we just got to give so much credit. So there is good news. I mean, obviously, way too many people that have died and had serious complications. But really, there is some, at least hopeful news that we can come together when we do unite together.
Dr. Shah, area superintendents disagree with the Harris County recommendations on metrics for returning to in-person class. Actually, there are only a couple of points they disagreed with. The county judge said it's currently not safe to open right now. How does it stand for who is making the final decision?
Well, first of all, I agree that it is unsafe for schools to go to in-person. So let me make sure it's not just the judge, it's myself as well, and obviously Dr. Persse and other health authorities across the community. We've all come to that same point. But I'll tell you, ultimately, the governor and the state have made it clear. It is not to the public health officials, unfortunately. It is the school district, school boards, and the school system that makes that ultimate call. All we can do is give our health guidance, our recommendations. And I tweeted this out just yesterday. I tweeted out my kid's picture, and I just said, look, it is not, in my opinion, safe for my kids to go to in-person schooling, and I would want to protect other kids just like that. That's my stance on it. I feel very strongly about it, and certainly it's not my decision, but I'm going to make my recommendations based on what I know from a health standpoint.
You know, I'm not comfortable with my grandchild going to in-person classes either. Testing. Tomball has a mobile testing site. Will you consider this for our area? I'm not really sure about what's in Tomball.
Yeah, I mean, we have mobile testing throughout the city has mobile testing. We have outside the city mobile testing, and I don't know specifically that one, but we are doing mobile testing throughout the community, especially where we see hot spots and places we want to we want to test.
Well, they're saying we can for us, but really we the public health, we're trying to target the hot spot areas, right?
That's right.
Absolutely. Mayor Turner says if you don't like the nose swab, get the saliva test. Are both equal?
So this is a great question. It's important people understand. So the test that's being done at Minute Maid is an oral saliva test, but it is a PCR test, which means it uses the same technology as the nasal swab test. There are other oral swab tests that use a different technology. Those are not as reliable. So the one at Minute Maid is an oral swab that uses the exacting technology, the PCR technology.
Okay. More than 16% of the Texans have tested positive for the virus over the past 7 days, with the highest rates of new cases relative to their population are in South Texas along the border with Mexico. Any comments about why those areas are hardest hit in the country? Is their experience a predictor of our future?
Well, one thing is on the first part of the question is that I think they may be confusing the positivity rate, which is the number of those tests that have come back positive from all Texans, so with a denominator. But as far as South Texas goes, this is a very concerning trend that continues over the last couple of months, and we are very concerned. We've been talking to our colleagues, and as you have as well, down in South Texas, and as well as Dr. Persse, this real concern about what's happening at the border. And there is a combination of poverty, a combination of healthcare access, and all sorts of other socioeconomic factors that go into this that are very much driving that. Now, that is also happening across the country. Disproportionately impacted communities are also disproportionately impacted because those very factors that describe their risk at COVID also describes their risk because of socioeconomic factors and other reasons for that increased transmission, and that is really concerning to all of us.
Chief Pena said the fire stations are cleaned via electrostatic cleaning. Is that superior to chemicals we use to sanitize our homes?
Yeah, so there are a variety of ways to clean industrial sites or office settings or homes and things like that. Most all of them are very, very effective. Now, the fire department is using this one because they've got a contractor that's coming in and doing it. If you wanted to get that for your home, you could. If you want to get it for your office, you could. I think the key thing for people to remember is that while it is important we clean our hands and wash those commonly touched sites, it appears that this virus still remains to be predominantly spread by it's spreading through the air. So it's important to clean things, but if you clean like crazy, you still got to wear a mask.
Some movie theaters are scheduled to reopen today. Any guidance for us as potential attendees?
Well, I think the first thing is that if you're at a higher risk category with chronic health conditions, older, I would say still I would not recommend you go out and do those kinds of things. We don't know what that risk is, and so hopefully those theaters have taken those kinds of steps, precautions, spacing people apart, and obviously not letting people come together and those kinds of things, and washing, cleaning surfaces. But again, I think each individual has to take their own risk in mind as they make these decisions to go out.
Yeah, agree.
I have visited several hospitals recently, and no one uses blood oxygen tests as part of the protocol, which seems to be a more accurate indicator than temperatures.
Blood oxygen test. So if they're talking about pulse oximetry, well, so I know exactly where that question is going, but I will tell you that pulse oximetry, a little thing goes on your finger, and they use a light wave to measure the percent of your hemoglobin that's saturated with oxygen. And this virus, which is breaking all the rules, has this phenomenon where people can feel fairly well, but their oxygen saturation level is dangerously low, or at least I should say alarmingly low, because they seem to be just fine. It's just been very misleading. It's been very complicating for those of us in the healthcare field.
That's right.
So when you're getting people who are short of breath and you test them, it's often frighteningly low, that oxygen level.
And the other thing is that fever is a marker that's very important in this.
But it's often late, right?
It's often late as well. Yeah.
Speaking of oxygen levels in the body with COVID, I was reading an article this morning about research which was talking about these bubbles that they're seeing in the blood, and they are present also in the brain.
The bubbles?
They're little bubbles, yes.
Yeah. So I just started seeing about it, so I don't know enough about it, but I did start seeing about that yesterday actually too.
Yeah, I was talking to one of my neighbors who's a physician, and he was telling me that this is present throughout the body, not just in the brain.
Okay.
Yeah. And I think the thought sometimes is that these air bubbles can actually cause some consequences. And so the real, right now we don't know what that is for COVID-19, but it is something to be concerned about. Obviously, continue to watch.
Generally, bubbles in the blood are a bad thing.
That's right.
Yeah.
How do they get there?
Well, that's the big question. You can get it. Well, you can get an air embolism from trauma, from an injury, where it introduces air into a blood vessel. You can also get it with rapid changes in pressure. Those are nitrogen bubbles. We see that with the bends, with scuba divers and stuff. But the problem is that the bubble, so when your blood cells go through the capillaries, the red blood cells actually have to bend in order to get through the capillaries. They're so small, so a very tiny bubble can get stuck there and then block all the blood. It's like having a tiny blood vessel occlusion. But if you have millions of these bubbles, it will do the same thing across millions of capillaries.
That's right. And we're learning maybe there's more microvascular effects of COVID that may be related to this, and we're just obviously watching closely.
COVID is quite different. Welcome. Thank you for joining us for our COVID talk with local health authorities. Dr. David Persse, representing the city of Houston. Dr. Umair Shah, representing Harris County. Special thanks to past President Kathy Feniger of the Houston Rotary Club. I'm Stephen Williams, the director of the Houston Health Department. See you next week for our COVID talk with local health authorities.
All right.